Good morning to all those who help us with this briefing, and good morning to Abdiel, who is in the studio, and to all our audience. We begin this conference today as it deserves to be, with a tribute to Jose Marti on the 125th anniversary of his fallen comeback in Dos Rios. He was the mastermind of the assault on the Moncada barracks in Santiago de Cuba and the Carlos Manuel de Céspedes barracks in Bayamo. And we do this by recalling some words spoken by our Commander-in-Chief on October 14, 1991, in his speech at the closing of the 4th Congress of the Communist Party of Cuba, and I quote, "You, Martí, were never defeated the day you fell in Dos Rios, and because of your example, because of your death, today there are millions of Cubans ready to follow your example, ready to defend your ideas, and ready to die just as you did to save freedom, to save justice, and to save honor and decorum of humankind," unquote. And with these words, recalling the speech made by our Commander-in-Chief, we begin this conference once again, paying well-deserved tribute to Jose Martí on the 125th anniversary of his fall in Dos Rios. And the information we have to provide today: for the 6th consecutive day, we are without reporting any deaths in our country. 824 patients are admitted in Cuba, 11 in surveillance, suspects 545, and 268 are confirmed patients. In primary health care, we have 2,053 people in observation. Yesterday, 1,668 samples were studied for SARS-CoV-2 and COVID-19. 722 were studied in the molecular biology laboratory of the Pedro Curie Institute of Tropical Medicine, 408 in the laboratory of the Provincial Center for Hygiene, Epidemiology and Microbiology in Havana, 269 in the laboratory of Santiago de Cuba, 207 in Villa Clara, and 82 in the lab of the brothers Aimeiras Hospital. As a result of the analysis of these 1,688 samples, 6 samples were positive, and this represents 0.35% of the samples studied. In this way, up to 12 o'clock last night, Cuba accumulated the study of 85,553 samples that had been analyzed in our country, and 1,887 had tested positive for 2.2%. I would like to clarify something. When we talk about 1,887 positive samples, we are talking about 1,887 people diagnosed with COVID-19 or presence of SARS-CoV-2. And we say this because the population has asked us if these 1,887 tests include some people, some cases that already confirmed, and as we have already explained, they test positive again. Those samples are not counted. Here, the people who are positive again in a second, third, or fourth test are not included in those figures. Of the 6 people who were diagnosed yesterday, all are Cuban. 100% are contacts of confirmed cases. And already in the Cuban epidemic, 89.4% of the cases studied are contacts of confirmed cases. They are 1,651 cases. The source of infection is not specified in 64 persons, that's 3.5% cumulatively, and with the source of infection abroad, which has no modification, there are 131 people, that's 7.1%. Of the 6 cases diagnosed, 4, that is 67%, are female. However, in the accumulated number of cases, that represents 49%. There are 925 of the 1,887 diagnosed are female, and yesterday there were only 2 male. Thus, the epidemic in our country remains at 51% of the diagnosed cases, 962 of which are male. 67%, that is 4 of the 6, were asymptomatic. And this brings the total number of people diagnosed in Cuba to 943, which represents 49.9% who are asymptomatic at the time of the diagnosis of the disease. As Dr. Otto Peláez told us yesterday, when they are only asymptomatic, it is really called infected until that moment. And then sick is when the person begins with symptoms of the disease. Therefore, 49.9% at the time of diagnosis are infected. Afterwards, many develop symptoms of the disease. Of the 6 cases diagnosed yesterday, 3 are under 40 years of age and 3 are over 40 years of age. So that's 50-50. It must be said that of the under 40s, there is one 11-year-old boy who was diagnosed yesterday in the province of Villa Clara. Of the 6 confirmed cases, 2 are from Havana, from the municipalities of Playa and Centro Habana. 2 are from the province of Matanzas, 1 from Cardenas and another from Matanzas municipality, and 2 are from Villa Clara province, from the municipality of Riachuelo. Of the 1,887 patients diagnosed with the disease, 268 remain in the hospital. And this is what we call the active patients who are still in the hospital. Of these, 97%, that is 260, present a stable clinical evolution, a favorable indicator that speaks of the recovery of these patients. Unfortunately, there are 79 deaths. I reiterate that for the 6th consecutive day, we have not had confirmed cases at the time of death of people diagnosed with COVID-19 in our country. This gives a lethality rate of 4.18%. And this lethality rate, when compared to the region of the Americas, Cuba is now in the 15th place, and this is a discrete improvement. Yesterday we were on the 14th place, and today we are in 15th. In the Americas, the death rate is of 0.98%, and 12 countries have a higher death rate than the one of the region. We always point to the situation of Mexico with 10.52, Ecuador with 8.25, Canada with 7.51, Brazil with 6.69, the United States with 6.02, and as we always say, in the countries here in the Caribbean region, there is also a number of countries with high death rates. We always mention the two people who were evacuated, and on the day there were 33 discharges. Another positive indicator, there is 33 discharges and 6 confirmed cases. And we are having a positive balance in this regard. Those there are now 1,538 patients of those confirmed in Cuba, that is 81.5% of whom have recovered and are discharged. And today we have to report on the situation of 1 patient in critical condition and 7 patients in serious condition. So we have 1 less in critical and the same number of patients in serious condition. Migratory movements yesterday were minimal, and today so we have the number of visitors remains the same with 9,365. Cubans residing abroad 5,538 and foreigners 3,827. Similarly, in the rental houses, the same number in the municipalities of Santiago, Plaza, Centro Habana, and Playa here in Havana. The world, as we also see in the news, in several publications, in the newscasts and on Telesur, until May 18, 185 countries with confirmed cases of COVID-19 remain. This means that there are now 4,679,511 confirmed cases. We're talking about the diagnosis in the world in just one day, 81,617 cases of the disease. Unfortunately, there were 3,417 deaths on the day for a total of 315 and 5 deaths. This gives a worldwide lethality of 6.73%. Now, more specifically regarding the region of the Americas, there are reports of 2,088,098 confirmed cases, 38,532 in one day. The confirmed cases in the Americas region now represent 44.62% of the total number of reported cases worldwide. In a single day, 1,771 cases died in the Americas, for a total of 124,862 people who have died from this disease in our region. This is a whole fatality rate, as we said before, of 5.98%. Well, before concluding, we wanted to remind our population of the availability here in Cuba of something that many countries do not have, but it helps us to detect people who have symptoms of the disease, and it is the self-assessment tool. The health personnel regularly conduct assessment, but we are also providing the self-assessment tool, which the population can access from their cell phones, digitally, given a group of information, and the important thing is that this information is relayed to a management center and can immediately send an alert to our health personnel. after the information is offered on such as what symptoms the person may have, and also a set of underlying conditions that may have been associated to risk factors, a visit is made by health personnel, and if the person really has a symptomatology that merits it, the person is then admitted to a hospital. This is something that has been explained on television. It has been said how it's done, but we really see that our population is not using it as we would like. Because regardless of the studies that are being carried out and that we have talked about here, the population studies and so on, the health objective of the Cuban state is to seek out the greatest number of people who may be infected and who do not have symptoms that are spreading the disease, so that we can immediately admit them and do the actions that have to be done in the control of the outbreak and for the treatment of this personnel. And this is what we had to report today.